Well, welcome everyone. I am really excited. I've actually lost count of which episode we're up to, but we are well on the journey to brighter days through better movement. June 20th will be the summer solstice, will be the longest and brightest day of the year. It's been a very challenging year. We've now reached the 1-year mark from when our pandemic officially began, and things are getting better. Our days are getting longer, 2 minutes longer every day. It's a little rainy today, but other than that, things are looking good. Virus counts are going down, more people are getting vaccinated. And so we're here to provide you with tips and resources and ideas and be part of that journey so you can be the strongest, healthiest, physically and mentally best that you can be in time for the summer solstice. So with that, today I have a colleague, a physical therapist with me today, Dr. Sarah Goldstein. Sarah, welcome.
Thank you so much for having me. This is very exciting and new.
Well, I'm really excited to have you. So let's start a little bit, before we jump into the future, let's start a little bit with the past. Tell us a little bit about your year dealing with the pandemic. How have you yourself, as a physical therapist, you need to stay active and healthy and fit and move, etc. How have you managed to do that yourself?
So fortunately, with working from home at the start of the pandemic, one of my husband's jobs at the time was being a kickboxing instructor. So he was leading classes from home. So I got to join in on all of those kickboxing classes, and I couldn't do any treatment when he was teaching because the music was playing. So I got to attend every single class that he took. So I was kickboxing like 4 or 5 days a week. So I was able to stay active that way. He doesn't work there anymore, but we did just buy a house about 2 weeks ago, and our heavy bag is in the garage, and we go out there, punch it, hit it, kick it, get out any sorts of frustration, lots of good exercise that way. So that's how I've managed to keep active. But without his push, I would definitely be a nap taker and a couch body potato by this point. So I appreciate him very much. But it's been a crazy year. My nephew actually turned 2 today, and we were supposed to be out there for his first birthday last year, but couldn't be because of the pandemic. But now that the vaccines are rolling out, we're trying to plan a visit out there to Arizona, where they live, for June, after my future niece or nephew is born, because my older sister's pregnant. So there are definitely brighter days, better things coming ahead. And I think we should hopefully be in Arizona for that summer solstice.
Well, what a great place to be. And it's really exciting to hear people having the opportunity to travel again is one of the things to look forward to as we move through and away from what was, maybe we can say what was a pandemic, not quite, but nearly. And I love your story about kickboxing. You basically got to do the virtual kickboxing, but you actually truly got to do it, and in between taking care of your patients. Tell us a little bit about that, because I know there's still plenty of people out there that may have heard you mention, when I was seeing patients. So, and still many people say physical therapy virtually. How does that work? Do you want to speak a little bit about that, and maybe even talk a little bit about the kids, because I know you treat pediatrics a lot.
Yeah, so treating pediatric patients virtually was definitely a challenge. When we first transitioned to telehealth back last year, I actually was with a different company. So my telehealth experience there is a little bit different than it has been with performance, but treating kids is the same no matter where you are. So I really pushed to treat all my pediatric patients in the clinic because it was so much easier. I get my hands on them, they're easier to engage. But I did have some patients who were medically compromised, and some of my kids had to be treated virtually. So I used a lot of props and toys and different stuffed animals at home to show parents, okay, try to get them to lead with this leg. Okay, try to have them reach with this arm, and put them on this side of you. So they have to look, hi, and put them on the other side. So they have to turn the other way, hello. So I definitely used a lot of different props to really get the parents engaged. And I think that is one of the true benefits to telehealth with pediatric patients is some parents are really engaged throughout the session, and some parents are just so glad that someone else gets to be with their child because the pandemic's been going on for a year. So telehealth really helps to, I think, educate parents more and help parents really be involved in their children's care and have the children see their parents as the ones who are helping them to improve and to make the right gains towards their goals.
Great points, because I know there's plenty of people out there saying, how do you treat a patient But your big message is so much is about the education of the caregivers or the parents, especially when someone is isolated and can't get into the clinic or the school. I know that many school-based therapists dealt with these challenges as well.
Definitely.
So for the people out there listening who have questions, whether it's about your own health or especially regarding pediatrics, we're going to dive into the kids in their communities who have suffered a lot during this time, whether they're those that have impairments or disabilities, or whether they're your average everyday boy and girl who haven't been able to get the same activities and outdoor sports that they may have in the past. So put your questions up. You can do it specifically through our website if you're watching on performanceptri.com/live, or through Facebook, YouTube, Twitter. The other thing is when you put questions up, you will get an extra entry into this week's drawing. So this week we are giving away an Under Armour Challenger Track jacket. It's a great jacket, as well as one of our PPT hats to the value of $100. So please ask your questions. This is a great chance to hear from Sarah, and it'll also help you increase your chances of going into winning a prize. So one of your specialty areas is pediatrics, and it's a broad subject. We did have a poll that went out to the audience to sort of ask, what do pediatric physical therapists treat? And it was nice to see that, developmental delays, sports injuries, movement, mobility, all of these things are the kinds of things that you take care of. And I know on hearing some feedback from you that, we talk about stretching, we talk about balance, we talk about strength training, all of the same things we talk about with adults. So let's focus some of those things on our kids. And I want to touch first off on stretching and flexibility. Tell us a little bit about your perspective on how much stretching kids should do from infants through the teens. How do we get them to optimize their flexibility? The stage is yours.
Okay, so stretching is going to vary throughout the lifespan. So if we start with an adult patient, which a lot of therapists and many adults have been in therapy, whereas maybe not as many kids, typically we'll say, do your stretches 2 or 3 times a day. And I think that when I first tell, say, an infant parent, okay, your child's neck is really tight. One of the biggest things with torticollis, which is when an infant is sort of almost stuck in a little bit of a head tilt and twist position, is that typically it can happen for different reasons, but when it's an infant who's had it since birth, that muscle, this one right here, your sternocleidomastoid, is born short. So because that muscle doesn't have a length to return to, we're trying to create that length from a shortened muscle. It takes more stretching. So I recommend stretching our infants with every single diaper change. So I'm not a parent, unless you count my dog, but I'm not a parent who's changed diapers, but I do have a long history of working with children, and diaper changes are an every 2-hour kind of thing. So every 2 hours, you stretch your infant. With torticollis, like I said, doing something called a football hold. So you take your baby, you slide your arm underneath their armpit, and then typically your baby's longer than this, you'll kind of hold on to the crotch, then you still have a free arm. We walk to the changing table, change the diaper, and then you switch and carry them back on the other side so they stay symmetrical. So with infants, they typically require more stretching. As you get into more of those middle school aged kids, as long as they're not going through a growth spurt, we can do stretching when they're doing an activity, before, during, and after. High schoolers about the same. You want to do before, during, and after. And then with those kiddos who sometimes experience growing pains typically occur because the bone grows and then the muscle has to catch up. So that muscle is almost on like a constant stretch. So you want to help by doing some more stretching, but be really gentle with it because, like I said, the muscle's already tense, and then we take it and we go, but be longer. And the muscle is there saying, you have to be gentle with those stretches. But one of the things I think moving through that ladder still to high school students, a lot of high school athletes might not be as active right now because they might not have access to their sport, whether I know they've been doing a lot of like fall sports during the spring sports during the fall to try to keep everybody equal. it's important that you maintain that flexibility when you're not doing your sport, because if you lose it, it's a lot harder to get back. Think back to those infants. They have to stretch them all the time because they never had that muscle length. Now, if you lose that flexibility and you try to go back to your sport, say you're a hockey goalie and you're trying to do that butterfly thing that they do on their knees to block the goal, if you lose that length in your adductors, that's going to hurt. So you have to kind of keep up with that stretching. It should really be a daily process.
Well, I really like how you've keyed in some major points from the infants, with torticollis is probably the diagnosis that most people would be aware of, with the shortening of the muscle in the neck, the growing pains, which we hear so much, especially through our tweens and teens, and then the high school athlete. And the big thing I'm taking away is to help people realize that when you're stretching an infant, that doesn't mean you're grasping this baby doll and yanking it. It's much more about positioning, and stretching is more about optimizing the mobility and the length of the muscles. We're not getting in there and cranking and causing pain at all. There's gentle techniques that we'll utilize to optimize the full mobility to restore that flexibility. And that's the nice thing about kids, is they have a lot more, there's a lot more basically water in their muscles and joints. So they're actually, it's easier to stretch them and make changes compared to old people like me.
I would agree with that. I think that a lot of times with pediatric patients, we see really quick progress, which is part of what's so fun about treating the pediatric population. And it's true, especially with infants, you're not cranking on their head. One of the courses I went to said you're going to apply as much pressure as you would to put a contact into your eyeball, which if anyone's used contacts, you're not like jamming it in there. So that's the amount of pressure for that. And then there was a student working with one of my colleagues a couple of years ago, and she said something really brilliant. She said, as soon as you feel the stretch, you're stretching. And I think that that's something to keep in mind once a child is able to communicate with you, which even they do in infancy, right? If they're uncomfortable, they're going to cry. So you know you're overdoing it. But keeping that in mind, where the stretch, like you said, Michelle, doesn't have to be painful. You just want to start to feel that stretching sensation. And then when you feel it stop there, hold it for those 15 to 20 seconds and then see if you can go farther.
Any self-help suggestions that you have? Because I know as a parent, and I've got teenagers, and I know many parents talk about, oh, you know, my son's got growing pains in his ankle and his knees. You know, we have Osgood Schlatters, we have severs, the things that come up a lot. Any key recommendations that you, or tricks that you would give to parents or these kids when they're suffering from these ailments?
So Osgood Schlatter and Sever's disease very similarly, right? It's about that pulling on, well, in Sever's, it's pulling on the growth plate. And then in Osgood Schlatter, it's that pulling on that tibial tuberosity right at the front of the knee. Again, still, you want to be careful with how intensely you stretch. And that I would say for those parents to really encourage the children to listen to their bodies, right? Our pain receptors go off and those discomfort receptors go off typically because something is going wrong. And so if a child is stretching and they're wiggling away from you, they're probably feeling some discomfort, so back off a little bit. Or if, you know, your athletic trainer or your coach is starting to stretch you and you're trying to sit there and say, I can take it, communicate with them. They're trying to help you. They're not trying to hurt you. So if it's hurting, communicate. So I think it's really about just educating your children on being advocates for themselves and for their treatment, and making sure that they are in tune with their body to understand that pushing through the pain, the no pain, no gain, doesn't necessarily help them long term. It might help them right now, but if you play basketball in your freshman year and you have an Osgood Schlatter and you don't take care of it and you keep putting strain on that quad and strain on that quad, you jump too high or you land too sharply one day, and then you can lead to, you know, a pretty severe injury of, you know, an avulsion fracture. So you want to listen to your body, because if you want to play basketball through your senior year in college, you have to start taking care of it now as a freshman in high school.
Excellent points. And I think you make an excellent point, because so many people are like, yeah, it's just a little growing pains. Just keep going. It'll be okay. But ultimately, there is a breaking point. And when you hit that breaking point, there is no solution but to completely rest it and take all stress off that area. And that's when you can't play, you can't practice. We do have a question coming in here. How do you get more information from your younger patients who may not always verbalize to you? This is your middle school, high school students. This is from Amanda Moran, who's one of our ATs. So great question, Amanda.
Yes. So this is a very good question. I use the parents. I think, if you're at a high school setting, you might not have the parents there. So in an outpatient setting, I'll use the parents as much as I can to help kind of speak for the patient if the patient is uncomfortable speaking. But one of the things that I have found, and it's interesting, I actually just spoke with, I have a student right now, my student about this week, is that I find the more you open up, the more they open up to you. So I don't have a whole lot of personal boundaries with my patients. Most of them know today is my nephew's birthday. Almost all of them know I'm on the podcast and I'm a little nervous. So I think the more you kind of open up and meet them at their level, they will feel more comfortable opening up to you. I had a patient and he's 6 last week, and he was not speaking. He would not talk to me. He would not talk to his mom. He would not talk to my student. His sister was in the room. And I went over to him and I started to whisper and I said, "Are you feeling overwhelmed? Like, do you want some water? Do you want to take a break?" So I gave him the water, I met him at his level. I sort of put us in a little private bubble. And then the rest of the session, he was bouncing off the walls because now he was comfortable and he felt like his needs were met. So taking the time to analyze the child and seeing, like I said, sort of where they're at, meeting them where they're at. And if it is an issue of verbalization, really trying to key in on their nonverbal cues. So is the child sort of backing up away from you, saying, maybe you're in my space right now and I need you to leave me alone. Okay, what can I instruct them to do? Or what can I demonstrate if they're not understanding what I'm asking? Or like I said, if you're trying to stretch and they're doing the little wiggle, like picking up on those things, because you do end up then meeting them where they're at, and they typically feel a lot more comfortable reaching out then.
Great points, Sarah. I think the other thing too, I have 2 add-on points, is that, it can be hard. People do get nervous. Even myself, I notice the older I get, the harder it is for younger people to relate to me. And they get nervous. And whether that's a kid or whether that's even a new professional as a PT, there's that age difference, and they're just nervous as well. They don't know what to expect. Sometimes kids don't have the words either. They don't know when they feel stretching. They don't know what a stretch feels like. They don't know, does this hurt? Is this pain? Is this right? Is this wrong? So they may not actually know the right words. It's easier for us as adults because we have some life experience. So you can even think of games like putting a color scheme to it. Red, like do the traffic light. Red is like, I'm really uncomfortable with this. So they might not know it meaning it's pain or it's stressful, but they don't like it. And green is like, no, I'm all good. And yellow is like, oh yeah, I think this is okay. So looking at other communication methodologies, because they may not have the verbal, the right words to describe it, and they may not have the body awareness either. They are so unaware of their bodies. So some of it is learning about what things should feel like. We've got another question coming in from Mallory Ruotolo. I'm sorry if I said your name wrong. Should my 6-year-old be stretching? Great question. If so, how often? The pandemic has obviously changed her level of activity, and she complains of her legs hurting sometimes. I love this question.
This is a very good question. I think that a lot of patients that I've seen across the spectrum of age have come in and they're like, well, my activity level changed and now I hurt. When your activity level changes, your muscles don't work as much, and then sometimes they shrink a little bit, and then things are a little bit looser and things are moving a little bit more than they should, and then we get uncomfortable. I mean, I didn't work out for 2 weeks and my left shoulder started subluxing, and I'm like, oh, I better start working out again because clearly that muscle tone's gone. So, taking this question for, as it is, I don't know your 6-year-old. I would love to know your 6-year-old. So if you need an appointment, call our scheduling. But I would say yes. I would say if they're, running around in circles and then they're like, oh, my legs hurt, they just did some exercise. Let's show them, say, like, let's just turn this so I can demonstrate. Excuse me. Right, we can show them a runner stretch. So you do this side by side with your child. Typically they like that. They like the one-on-one time with you, right? I'll put my hands on the wall, 1 foot back, 1 foot in front, leaning into the wall to get the stretch of the back of the leg. You can do a nice hamstring stretch with your child, having them kind of put their leg up on a step, right? And they can reach forward and try to touch their toes, especially a 6-year-old, someone who might need to work on their balance. We can have them stretch the front of their leg, standing on one leg, holding onto a stable surface, and pulling that knee bent and that heel up towards their butt. I wouldn't say, get her on a really serious stretching regimen of 3 times a day. She must do this. I think it more would do with her activity level, stretching sort of in response to what she's doing. If she likes, if you have like a playground in the backyard and she's going up and down the ladders, up and down the ladders, up and down the ladders, and then her legs are feeling sore again, sort of in response to that. And you can also consider almost doing like a warm up with her before she does any of these more active things, so that it's a little bit less strain on the body. So, oh, you want to go play outside? Okay, why don't we take the time inside? Let's, play catch real quick, or let's climb around on the couch. Let's go up and down the stairs first and get our body warmed up before we go full force into backyard sprint, whatever we're going to do out there.
I think too, Mallory, that there are 6-year-olds need a lot of variety, and that when there isn't a pandemic, that's why playgrounds are so great, because they climb, they run, they jump, they're climbing underneath things and on top of things. So formal stretching doesn't really need to happen, because they're maximizing the mobility of their joints and soft tissues with all these different activities. And that's one of the issues with the pandemic. They haven't had those opportunities. So I anticipate that there'll probably be many 6-year-olds who, as they increase their activity levels, may go, I'm a little sore, I feel, and that's okay. You're not hurting them. It's actually okay. And I think another way to think of it is movement and exercise at any age does something called desensitizing some of our nerves. So the more you actually move and are active, and Sarah, your example was great. I did nothing for two weeks, then my shoulder hurt. Yeah, you lose some strength flexibility, but the other part is the nervous system starts evolving. So the more you move and you're active, it keeps your whole nervous system down at the level it should be. And the more sedentary you are, you actually become a little bit more hypersensitive to any movement that goes on. So it's a fine balance. You don't want to do so much movement that you hurt yourself, but for kids, pretty hard to actually get an overuse injury unless you're, say, playing sports all year round and organized sports, and we're getting more into the tweens and high school. But for your 6-year-olds to have an overuse injury because they overdid something, it's pretty much unheard of. So I would say that even if your 6-year-old is complaining of some soreness, say, you know what? Let's just move some more, do these stretches. Now tomorrow, let's warm up, let's go to the playground, let's look at some variety, and you're going to get you're going to totally help them in that way.
Yeah, one of the biggest things about kids, like you were saying, Michelle, just to reiterate, is the importance of play. I mean, play, that's their job. So we know they go to school, but their job is to play. They're made to burn out your energy as well as their own, and you're going to burn out before they do. So, but let them burn out that energy, because they typically want to be moving. And if they don't want to be moving, if you have a child who isn't big on running, isn't big on jumping, isn't big on playing, see if there's anything you can do for their mental energy. Give them puzzles. Video games get sort of a bad rep, but if they have to be problem solving and thinking their way through something, or if it's a puzzle, or if it's a maze, or if it's a this or a that, as long as they're still getting that energy out, that is also such a good way for them to continue to be able to do what they're supposed to do and play.
And that energy lets them sleep better. They're going to be better, have better appetite. So your nutritional challenges can be easier to manage. So all good things for the health. I am so happy that your grandmother is watching.
Hi, Grandma.
A big shout out to you. And we love your granddaughter. You obviously played a very important role in her upbringing, and she's providing great services to our community. So thank you, and appreciate that. Jimmy Sorrell, another great question here. Are there different types of stretches that should be promoted or avoided depending on the age? And I guess my question is going to, right now, Sarah's like, where do I start? I guess I'll jump on a little bit just to say, shall we talk about the difference between dynamic versus static versus ballistic? I sometimes think when people think stretching, they go like, oh, this means I've got to hold it for 30 seconds, do it 3 times. So do you want to speak a little bit into the types of stretching and flexibility that you would recommend at different ages?
Sure. So I don't know that I would necessarily avoid or promote any specific kind of stretching at any given age. In general, again, I think it's about sort of teaching that body awareness and teaching that child to really listen to their body. So typically it's recommended to do like dynamic stretching before you exercise. So before you lift up, a 50-pound kettlebell to do squats, maybe start with some squats without the weight so we can get the muscles moving and stretching that way. And then you do your static stretches more so at the end.
You've got a great, I think the point here too is that, Virginia, realizing that stretching, sometimes we think of stretching as, oh, I'm trying to maximize my flexibility, when really a lot of the time it's about optimizing the mobility. So hence why dynamic warm-ups are about, all right, let's really warm up these muscles and take them through a full range of motion so that they can then function at their optimal positionings, and they've got all the nutrients there so that they're safe. Now, when you're doing something like repeated squats, because you're working in a smaller range of motion, you're only working your quads, your glutes in a smaller range of motion. So to prevent any true shortening of the muscles, that's why we add on the sustained stretching at the end. So we can, again, get that full mobility there. So we're not losing any of that mobility. So I would only add to Jimmy, what you're saying is that I just would be a little bit wary. The only time I would be wary is if you've got a kid who's suddenly like, I want to do the splits, and they want to like completely like cause actually pain and do things that can be actually cause injury. So, but then you've got kids who want to be gymnasts and ballerinas. They're all going to go through some different stretching routines, but make sure they're doing it with a coach, with a professional who knows how to really lengthen those muscles that need to for those certain kinds of sports. Make sure they're on the right program so that they're doing it safely. And you just don't have a kid at home saying, oh, I'm just going to stretch the heck out of this until I can do the splits or do some crazy ballerina move. Make sure they're getting the professional guidance to do it safely.
Yeah, I think that's an incredibly good point. And that causes me to think, when I work with my dancers, what stretches do I give differently to my dancers versus to, maybe a soccer player? Because the soccer player they have to be able to kick pretty high, but they don't have to get their leg all the way over their head like the dancers might. And one of the things I typically shy away from with my kids is me stretching them. I like them to be in charge of the stretch because I find, like Amanda was asking about, can they communicate? Right? If they can't tell me that it's too much, I'm really not going to know unless I'm picking up on those subtleties. So I'd like to do more child focused, like they are doing the stretches and I'm going to help and make sure that the form is correct. I'm going to help them count. Because if you ever tell a kid count to 30, they go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 30. You don't live longer than that.
Oh, I love kids counting. Amy Sullivan is asking about tiptoe walking. We see this a lot. Can you give Amy some thoughts on her 11-month-old that enjoys walking on his tippy toes?
Yes. So one of the things in the course I took on toe walking is that some pediatricians will say, oh, it's normal, they'll grow out of it. However, in the PT mindset, because I don't want to disagree with any pediatricians out there or cause any fights, but it's not normal for a child to walk on their toes unless, let's say, if he's pushing on the toy and he starts to fall forward, so he goes on his toes so he can catch up, but then he ends up going back flat. So when a child is walking on their toes, it's typically for any number of reasons. A lot of the times when they're that young, they could be kind of using that plantar reflex or that toe gripping to try to really get up there because they want to go and they want to walk. So working on really promoting them to get sensory input through their entire foot so that when they get up to walk, they are able to put their whole foot flat. Some different ways to really promote that is doing, a lot of different, don't mind my lunchbox, I was snacking before we started, some short sitting activities. So if you have the child sit on your lap, Obviously, your 11-month-old is probably bigger than my doll, so his feet would be on the floor, and giving a little bit of compression down through his knees so that his feet end up flat. So if he's sitting, see what a pretzel I can be. If he's sitting on you and his feet are here, you're going to kind of push through so that his feet end up flat, so we can start to get that input there through his feet, through the whole foot, so he becomes more comfortable with that. And in that, you're also getting stretches to the bottom of his foot, stretches to his Achilles, stretches to the muscles on all the backs of his legs. If, this is something that he continues to do, obviously, Amy, you can always bring me your 11-month-old. And we can go over some other things in detail. But toe walking is one of those things that the longer you wait to treat it, typically the more difficult it is to get under control and rectify, because it's one of those cyclical things where maybe the child is walking on their toes because they don't like sensory input through their heels, and then they practice walking on their toes, and then that's just what they do, and then the muscles get tight. And now it's not just a sensory thing. Now we also have that muscular component to address. And that makes it sort of more of a twofold thing to work on. But I have seen some really good success working with older toe walkers. It's a very patient process. I know before I said kids typically get better so fast. Toe walking is not one of those things that gets better quickly. So the sooner you notice it and you start to kind of nip it in the butt and really help him feel what his foot feels like flat on the ground, the easier it'll be for him to engage in a more typical gait pattern.
And it's such a habit. That's one of the key things with toe walking. Once it becomes a habit and their whole neuromuscular system thinks this is how you walk, it's hard to break. I mean, I think I was a toe walker, because now if you put me in bare feet, I always just want to walk on my toes. I mean, I still do it to this day, and I fight with always having to continually stretch my calf muscles because of it. But there's nothing wrong with me. I think it's just you get into those habits as kids, and the sooner we can create environments to normalize, so to speak, then the easier it is to stop those habits from coming up. Jamie Moore is out there talking about her 3-year-old son, where she's got the little boy who suddenly says, I can't walk, and starts to limp. I hear this come up a lot, actually. As a parent, you often hear of the other parent who says, suddenly I can't find anything wrong, but now my child says they're limping, but there's nothing wrong with them. You come across that, Sarah? Sarah's like going, oh my goodness, what is this? I'll just jump in and give you my thoughts on it, Jamie. Is sometimes kids, they don't have that greater body awareness, and sometimes they'll play out in different ways. So sometimes a kid might have something else going on, like a sore tummy, or they're upset that they're about to get a sibling and they don't know how to express that. So kids can act out in funny ways. So the number of times that I've seen this, and I've often heard parents complain about it and treated it myself with kids, is that don't ignore it. Don't say there's nothing wrong with you. That's the worst thing you can do. Like, just let them, just go through it with them. Show them, hey, yeah, we'll examine it, take it seriously, all of those things. But I would just say then just look at activities that they can do that will help you feel better as a parent, to think, oh, they are okay, such as take them to the playground and notice that they suddenly can climb up a ladder and go down a slide, and that seems fine. Yet when they're walking around the house, when they're tired, they've got pain, that to me is telling me that, oh, there's something else going on. And love them, empathize with them. If it goes on for more than a few days, obviously, but rushing into the ER and getting x-rays, and there's no need for it, because if there was truly some inflammation or pain or true pathology, you would be able to assess that and understand that's happening. But yeah, kids can sometimes present themselves in different ways, and we shouldn't ignore it. They just don't always know how to communicate what's going on, especially 3-year-olds and 2-year-olds.
And also sometimes there's like a mimicry component. If they saw something on TV and they thought it was funny, so then they wanted to try it. But typically, especially almost 2, 3, they're still pretty bendy at that time. So unless you see any of those red flag signs that you said you were looking for. You know, it is like Michelle said, just, oh my goodness, we have to check it out. Are you okay? I often do that. Oh no, do we need to amputate? And then they giggle and they're like, oh no, I'm fine. Like, okay, let's go back to your exercise that you didn't want to do now.
Exactly. Turn it all into a game. So we've talked a lot about stretching, and there's lots to obviously talk about. I know one of the other things that came up earlier actually was balance. And I think it would be really great to hear some benchmarks for listeners out there. People often think, well, when should you be at a single leg stand? How much should a teenager versus a 3-year-old be able to balance on one leg? So maybe you can speak a little bit about the progression of children and their ability to balance and navigate those dynamic activities.
Yeah, sure. So even from an infant age, infants are born with what's called a walking or a stepping reflex. So if you ever pick up your baby and you put them on something, right, and then they just start kind of marching, they're already starting to practice that single limb stance. And standing on one leg is really functional because every time you walk, you balance on one leg. But it doesn't just happen overnight. I have a 1.5-year-old I'm working with now who does not like to stand on her left leg. So I force a lot of single limb stance, and that looks very different. Today, she was in a half kneel position. So she had one knee down and then we had that left foot up, and she was playing with, I have rolls of tape. So she was putting weight through that left foot, practicing sort of getting that balance in this position, but mostly sort of getting that weight so that we can then transition to one leg. Single limb stance as you go a little bit older, as they start to climb on things, is just a matter of, okay, I'm going to stand on my left leg. I'm going to pick up my right leg to climb onto the couch. And that's practicing single limb stance. And then when they start to cruise, right, they still have their hands on something and they're walking either sideways in circles around an ottoman or a coffee table, they're practicing single limb stance. By the time they hit 3, that's when we're looking for them to be able to stand, hands on their hips, and stand on their legs for maybe 3 seconds. It's not like all of a sudden 30 seconds, you're great. Obviously, when it comes to a little bit older, maybe we're like at 6. I think 6 is probably around 20 seconds or more that you want to be able to balance on one leg, because that's when the one of the gross motor scales I use stops at 6, and I think it's 20 seconds where you get full credit. So I'm going to say that. But you know, moving on, as you get older and older, you want to be able to hold for at least 30 seconds. Athletes should be able to balance on one leg, dynamically catching things, having things thrown at them for probably like a minute on different surfaces and things like that. By 3.5 is when we want to start to see hopping on one leg. So that's taking that static, standing on one leg, and now I can move in and out of this position and maintain my balance that way.
Great points. And I love it that, you know, making sure for all of the parents, all of the caregivers and the kids out there that getting these fundamental balance skills in place is going to minimize your risk of injury, but also optimize your ability to perform at those higher levels, especially if you want to get into different sports in high school and college. All right, let's see who the winner is of our drawing today. Either Sarah or Nick in the background, our other Sarah, are going to come on. We're going to do a drawing to see who is going to win our fleece and our hat. All of the people that entered through performanceptri.com/live. And anyone who's listening today, please feel free to join our podcast series, because you will go into the drawings for every week going forward right through to June 20th. So Sarah Wilson, tell us who today's winner is.
All right, the winner for the Under Armour Challenger 2 track jacket, can't even speak today, I'm so excited, is Ginger Howley. Congratulations, Ginger.
Yay.
Great job. Good job, Ginger. And our team will be reaching out to you to make sure we get the right size fleece for you. All right. Well, next week, 1 o'clock, we are being joined by Lindsay Arcand. It used to be Harris, but now it's Lindsay Arcand. Lindsay is a physical therapist. She's been with us for many years, actually. It's exciting because she was an exercise specialist who ultimately became a physical therapist and joined our time. A young local lady. She will be joining us to talk about managing stress and making strength training accessible for everybody. Strength training is something we should all be incorporating into our weekly programs. So we want to make sure that everyone knows how to do that. All right, Sarah. So you've had a lot of spare time during the pandemic, although it sounds like you've been busy kickboxing as well as continuing to treat patients. And I'd just like to ask this, any recommendations you have for people out there on a TV series, a podcast, or a book?
So the current podcast I've been listening to is recommended by one of my best friends who's also a physical therapist. She works in early intervention in New Jersey, but it's called Two Sides of the Spectrum. And it is an occupational therapist who interviews many autistic adults about OT practice. And a lot of pediatric physical therapy and occupational therapy work really well together. And I do have a few autistic patients that I just want to give my heart and soul to, and I'm trying to learn as much as I can about autism so that I can give them everything. I just want to give them everything. I just want them to be successful little beings, and I love them so much. So that podcast has been absolutely amazing if you have an interest in that. And then the pandemic TV show for my husband and I has been New Girl. No, it's like an older show, but we did adopt a dog and name her Cece after one of the characters. So if you have not yet watched New Girl, I think it's very funny.
I always like something that's funny to watch, so I'm going to add New Girl to my list because I'm tired of watching things like the Batman movies and Marvel movies, which is what I get stuck watching with my teenagers.
I love the Marvel movies.
You do get, I like the sound of New Girl. All right, we have 10 seconds remaining, Sarah Goldstein, and this is your 10 seconds, your 10 seconds of advice and suggestions for all of those listeners out there. What are the big takeaways? Ready, steady, go.
Definitely let your kids play. Let them be barefoot more so they can really learn their environment, get more input through those feet. Let them try new things because if you're afraid, they'll be afraid. So let them explore. Let them balance, stand on one leg through all those different ways that we talked about. Keep them moving. Let them stretch it out. Let's see, help you like put your phone down so they put their phone down and their screen down and really interact with your kids. Help them to engage more with your family. Let them climb all over the couch. I know a lot of parents don't let their kids do that, but it's so good. And really just let them play, let them explore, let them be kids. How did I 10 seconds?
Awesome. Thank you so much, Sarah Goldstein. We really appreciate you being on the show, and all the best,
Thank
everyone.
you so much.
See you next week.